Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss what is the difference between CRP and hs-CRP. Many a times we get this question that what is better, CRP is better or hs-CRP is better. hs-CRP is slightly costly, so can we just get a CRP test? And do we really need this hs-CRP? So can I do hs-CRP only? And such questions come. So what are these? What is the difference between these two tests? And we will get answer to all these questions when we try to understand the difference between the CRP and highly sensitive CRP. Okay. Just to give you an example, you can see here that this merchant is weighing this half kilo rice or a kg rice in this weighing machine, and similarly this is a whole sack of rice, and here he is using this huge weights to measure this. So why can't he measure this on this weighing machine, and why can't he use this sack of rice on this machine? He can do it, it's not that he cannot do it, but the thing is that when he wants to measure this weight, this sack of rice here, he needs to have a sturdier machine, he needs to have huge weights, etc. So this is when the same thing, when he wants to measure this small amount of rice here, he will have to have very small amount of weights, etc., to weigh this. So similarly, what happens whenever there is a huge rise? Okay, when the level of inflammatory mediators, the C-reactive protein, is very high, we can use this method of detecting. This method detects a very low rise of CRP, and this is sensitive to this rise. Okay, so the way it is detected, the way this test is done, that there lies the difference. So CRP is a test that measures CRP levels in a range up to 1000 milligram per liter in the blood. Okay, CRP, if it is more than 1, we say that it is elevated. More than 1 to 3 is normal, but we measure it more than 1. Whereas hs-CRP measures the CRP level in the range from 0.5 to 1. That small amount this hs-CRP measures. So hs-CRP will measure a very small rise, 0.5 to 1. Whereas CRP is going to measure in a large quantities from 1 to 1000 milligram per liter. When the level of hs-CRP, if it is up to 1 milligram per liter, we say it is low risk. If it is 1 to 3 milligram per liter, it is moderate risk. And if it is more than 3 milligram per liter, it is high risk. If it is going more than 10 milligram, etc., we are not considering this as a test. It could be, because we ask that, we tell the patient to get a CRP done, or we ask the patient to repeat the test after 3 weeks. So the sensitivity of this is, at a very, very small amount, this is able to detect. That is why it is called highly sensitive CRP. If the value goes higher, we would prefer CRP. Okay, so if a patient is having an infection, if he is having very bad infection and all, there is no point in doing a hs-CRP. The better indicator would be a CRP. So in COVID cases, when there was infection, lung inflammation, we used to tell patient to get a CRP, because that helps us to identify. If the level of the value is very high, then CRP is a better test rather than hs-CRP. CRP, when the level is up to 10 milligram per liter, we say it is slightly elevated. If it is 10 to 100 milligram per liter, then it is moderately elevated. And if it is more than 100 milligram per liter, yes, it is markedly elevated in case of severe trauma, acute bacterial infection, etc. Test CRP test measures CRP in the level of range up to 1000 milligram per liter, whereas hs-CRP is very sensitive. It will detect a very low rise in the CRP. That is why it is highly sensitive. Mostly done test is CRP. Mostly well-known test is CRP. hs-CRP is being popular in the recent times. It is not as popular as CRP. Whenever there is an acute infection, whenever the patient is having cough, whenever the patient is having fever, patient is having acute exacerbation of autoimmune disease, is having SLE, rheumatoid arthritis, is having inflammatory bowel disease, doctors order CRP. Okay, the hs-CRP has certain criteria when it is ordered, but most commonly what we see, which we order the test is your CRP. Sensitivity wise, CRP is a less sensitive test, whereas hs-CRP is a more sensitive test. I mean, very low rise also. A little rise is also detected by this hs-CRP test. So this test is highly sensitive C-reactive protein test. Here in CRP, I have told you, you can get the normal result up to 6 milligram per liter. Okay, whereas here this is a very low rise. This is up to 1 milligram per liter only is considered as normal. So CRP, it is used to diagnose acute infections. It could be bacterial infection, inflammation, fungal infection, viral infection, COVID-19 infection. It could be inflammation, inflammatory bowel disease, autoimmune disease, SLE, rheumatoid arthritis, Sjogren's syndrome, psoriasis. It is also used to monitor certain disease. It is used to see how the treatment is going on, how the patient is responding to the treatment. For all these things we use CRP. Okay, but hs-CRP mainly we are using for knowing the cardiac risk, whether this patient is having a risk to develop heart disease. Why? Because this detects a very small rise in CRP. It could be inflammation in the arterial walls of the heart. So this rise and inflammation is nothing but atherosclerosis. There is a damage to the endothelial vessel wall. This CRP, the pentameric CRP becomes the monomeric CRP. It activates the complement system. It activates the inflammatory cells. Leukocytes come there. There is production of these foam cells. There is this atherosclerotic plaque developing. There is, neutrophilic aggregation, platelet aggregation. They form thrombus. So the inflammation starts. And when this inflammation is there, the CRP is going to rise. And this is your hs-CRP. So this hs-CRP is recommended for individuals who have significant risk of developing heart disease. They have a family history of heart disease. They have cardiovascular issues. In routine checkup, you find that patient is obese. He is having high cholesterol. There is a risk for developing this heart disease. For such patients, we order this hs-CRP and we correlate with his lipid profile, with his past history, with other risk factors like obesity, diabetes, lifestyle, habits, etc. And then we calculate the risk, cardiovascular risk for such a patient. hs-CRP mainly is used to assess the cardiac risk. So these are few of the differences. See, CRP, it costs you around 500 rupees and hs-CRP would cost you around 700 to 800 rupees. The cost wise also hs-CRP is high. We do not order hs-CRP in all patients. We order hs-CRP in a patient in whom we are suspecting a risk of developing cardiovascular disease because it detects a very low rise in CRP also. Okay, so this hs-CRP, very slight change in CRP Okay, whenever there is a slight change in CRP level, and CRP might be in normal range, this patient can have, if you do CRP for this patient, you might get CRP in the normal range, but when you do hs-CRP, that very much low rise what has happened, that can be detected by this test. So there is a small increase in the baseline level of the CRP, typically between 1 to 3 milligram per liter, there is that increase, and they are only detectable with this highly sensitive CRP test. Okay, and hs-CRP level over 3 milligram represent that this patient is having a highest risk of developing a cardiovascular incidents. So in healthy individuals, the baseline concentration of the CRP is, I have told you, it should be less than 1 milligram per liter. Okay, and if you are getting a hs-CRP value more than 300 milligram per liter or higher, we are not considering that test. We order CRP, or we order this hs-CRP after 3 to 4 weeks. So CRP measures the level of the C-reactive protein when the range is very high, and hs-CRP measures the level in a very low range, 0.5 to 10 milligram per liter. So hs-CRP measures the range of CRP in a very low range. Hence, this would be an hs-CRP. It is measuring in a very low range, and this is CRP. It is measuring in a high range. It all depends upon the range at which these tests are measuring. Okay, so CRP, yes, a more popular test, more frequently ordered test, especially in infections, inflammations, etc. hs-CRP, when compared to CRP, is a less popular test, because we order this test in a particular group of individuals, like person who is having a heart risk, person who is about to develop a cardiac disease, he is obese, he is having a family history of heart disease, etc. In such cases of population, only we order this hs-CRP. CRP is a less sensitive test, hs-CRP is more sensitive. The normal range I have told you, up to 10 milligram per liter, it should be up less than 1 milligram per liter, and this test mainly for inflammation, for autoimmune diseases, for infections, see the treatment response, etc. We use this CRP, whereas hs-CRP, it mainly to know the risk of developing heart disease, stroke, peripheral vascular disease, etc. So to assess the risk of developing a cardiac disease, we do the hs-CRP. So these were few differences between CRP and hs-CRP. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.